You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. I'm going to be joined in the studio with Becky May. She's a nurse and it's the NHS Swale Clinical Commissioning Group. It's part of the regular slot that we actually do with them. We're going to be speaking to Becky this time. We're going to be covering our theme, asthma. So firstly, welcome along to the show. It's good to see you back here.
Hello, good evening everybody.
Now, I actually thought asthma is normally associated with autumn.
It is true that most cases are reported from September as the cooler weather leads to more coughs and wheezes, especially in children who are just going back to school. But anyone who suffers from hay fever knows that this time of the year can be just as distressing as the pollen count gets higher.
So, do scientists actually know what causes asthma then, Becky?
Well, yes, during an asthma attack, the muscles in the lungs, air passages, go into spasm and the lining of the airways swell. As a result, the airways narrow and breathing becomes difficult. An attack can be triggered by extremes of temperature, a cold, cigarette smoke, stress, or an allergy to food like milk, eggs, fish, and nuts. Fur and feathers of a family pet can also bring on an attack. Research has shown that smoking during pregnancy significantly increases the risk of a child developing asthma as well. Similarly, children whose parents smoke are more likely to develop asthma. This is a particular problem in Swale because we have one of the highest proportions of smokers in Kent and Medway, although the number of smokers is gradually getting smaller, thankfully. Sheppey also has many fields of rape, which a lot of asthma sufferers are sensitive to, and until recently some sufferers in Sheerness complained of attacks being brought on by pollution from the steelworks. But the problem with asthma is that it can affect anybody. Anyone can have this. Celebrity asthma sufferers include the world's fastest woman marathon runner, Olympic athlete Paula Radcliffe, your soccer star David Beckham, actor Stephen Fry, and Who Wants to Be a Millionaire TV presenter Chris Tarrant even, who supports the charity Asthma UK.
How serious actually is asthma?
Well, there are more than 1,000 deaths attributed to asthma every year in Britain, and it is also responsible for tens of thousands of emergency admissions to hospital. But doctors believe a staggering 90% of those admissions and deaths could be avoided by helping people understand what causes asthma. And then teaching, the educational side is vital, teaching them how to spot the symptoms and what to do if they see someone having an attack.
Now, I've seen people using inhalers, and probably most of you out there probably have at some time, but what are they for?
Well, there are two types, preventer inhalers and reliever inhalers. Preventer inhalers are usually brown, red or white and help to reduce the swelling in the airways. They are best used before an attack and are usually prescribed for children and young people who are using their reliever inhaler 3 or more times a week. The reliever inhalers, usually blue, are used, as the name implies, to relieve the symptoms of an attack.
Becky, I was wondering, what should you do if you have asthma?
There is no cure for asthma, unfortunately, but the condition can be controlled with medication. Those with asthma should visit their doctor at least once a year for a checkup and to discuss treatment. It is important friends and family know how to help in an emergency. Asthma UK provides a free asthma attack card which shows how to recognise an attack and explains what to do, so don't get caught out.
So what should you do if you have an asthma attack or you see somebody having an asthma attack then?
Well, fortunately there is a 6-point checklist for those suffering an attack. 1. If you have an asthma attack, take 1 or 2 puffs of your reliever inhaler immediately. Children sometimes have a spacer which goes between the mouth and the inhaler. 2. Sit down and try to take slow, steady breaths. 3. If you do not start to feel better, take 2 puffs on your inhaler, 1 puff at a time every 2 minutes. You can take up to 10 puffs. 4. If you do not feel better, or if you are worried at any time, do not hesitate and just call 999 immediately. 5. If an ambulance does not arrive within 10 minutes and you are still feeling unwell, continue taking 2 puffs on your inhaler every 2 minutes. 6, and lastly this is, if the symptoms improve and you do not need to call 999, you should still see a doctor or an asthma nurse within 24 hours, and that's very important. If you see someone becoming extremely distressed, and that is a natural reaction when they are gasping for breath or beginning to turn blue around the lips through lack of oxygen, again just dial 999 immediately.
I was just wondering, can you avoid an asthma attack?
Well, I hate to talk about it, but in cold weather it is particularly important to wrap up well and use a scarf, as cold air can trigger an attack. But we are coming up to midsummer now, and hopefully we're in for lots of nice warm spells. But at this time of the year, pay special attention to the pollen count. It is often flagged up on the TV weather forecast, and that's usually at the very end. If it is high, do your best to stay indoors. Walks in the country should be avoided. If you feel concerned, phone your GP practice. If the practice is closed, then just call NHS 111 for advice.
So where can people get advice?
Asthma sufferers can order a free pocket-sized card called What to Do in an Asthma Attack from www.asthma.org.uk. So that's www.asthma.org.uk to carry with them.
Well, Becky, I'd like to thank you very much for coming along and covering asthma for this visit.
Thank you.
That is Becky coming in as part of our NHS Swale Clinical Commissioning Group's regular slot, and this time we were covering asthma.